Okay, so you're getting ready for surgery. It's totally normal to feel a bit anxious, but honestly, knowing what's coming can make a world of difference. That's exactly what we're going to do here. Walk you through your journey at the Murray Falconer Ward, step by step, so you feel confident and ready. Let's dive in. We've broken everything down into 5 simple stages. First, we'll cover what happens right when you arrive. Then, we'll talk about getting prepped for your operation. After that, it's into the theater and recovery. Then we'll look at your time back on the ward, and finally, the exciting part, getting you all set to head home. It's a clear roadmap from start to finish. All right, let's start at the very beginning. Your journey really kicks off the moment you get to the ward. This first part is all about getting you settled in and going through a few important routine checks. So as soon as you're here, the nursing team will get things rolling. They'll check your height and weight, take a few blood samples, and do a couple of safety swabs. Now, you might hear terms like MRSA and CRE. Don't worry, this is a completely standard safety check that every single patient gets. It's just to keep everyone safe. After a quick check of your vitals, they'll ask you to pop on a theater gown. It's all a very smooth, organized process to get you ready. Okay, once those first checks are done, it's time for a final review with your medical team. This is a really crucial moment where you get to connect with the very experts who'll be taking care of you. And this is so important. This is your time to ask anything and everything. Seriously, no question is too small or too silly. We want you to feel completely in the loop and comfortable. So if there's anything on your mind, now is the perfect time to ask. During this meeting, you'll actually get to speak with people from both the surgical team and the anesthetic team. They'll just confirm your consent one more time and, like we said, answer any of those last-minute questions you have. Think of it as the final huddle before the big event, making sure everyone is on the same page. So what happens next? Well, we're moving on to the operation itself, and that immediate recovery period right after. It's really helpful to get a handle on the timings here so you and your family know what to expect. You know, the whole process is managed really carefully. You don't need to be a clock watcher. A member of the team will come and get you personally when it's your turn and the theater is ready for you. Now, for the time frame. The surgery itself usually lasts somewhere between 4 and 6 hours. This is a really key piece of information to share with any family or friends who might be waiting, just so they have a clear idea of the schedule and aren't left wondering. And after the operation, there's another really important phase. You'll spend about 4 hours in the recovery room. Now, this isn't back on the main ward just yet. It's a special area where a dedicated team can keep a really close eye on you as you start to wake up from the anesthetic. Once you're feeling stable and awake enough, you'll be brought right back to us on the Murray Falconer Ward. And this is where the next stage of your recovery really begins, with some dedicated post-op care. You'll probably notice the nurses checking in on you quite a bit more often, especially in those first 4 hours. We call these post-operative observations, and it's completely normal. Because of this, you might find your bed is a little closer to the nurse's station. It just makes it easier for us to keep a close eye on you. After that initial, more intensive period, your care settles into a pretty predictable rhythm. As you can see, these checks happen at regular times all through the day and even during the night. A lot of people find this schedule really comforting because you always know when to expect us. And before you know it, it'll be time to start planning for that last part of your hospital stay. So let's talk about the final steps to get you ready to head home. On the day you're heading home, a few things need to fall into place. The team will be busy getting all your medications and paperwork ready for you to take with you. While that's happening, you might be asked to relax in our comfortable discharge lounge. And of course, the big one, please make sure you've got a ride home all arranged for when you get the green light to go. Oh, and here's a really practical tip about work. The hospital will give you a sick note that usually covers you for at least 2 weeks. If you feel you need more time to recover, which is very common, don't worry. It can easily be extended by your doctor or your GP. And that's it. That's the whole hospital journey, from start to finish. By knowing what to expect at each step, you can be a real partner in your own care. Having this clear plan in your head is such a powerful first step on your road to recovery. We wish you the absolute best.